Hello, today we're going to be doing a central line dressing change. I have checked my orders to make sure that, the order for this is in there. I'm going to do my general safety practices, hand hygiene, making sure the patient is who they are, two patient identifiers, that kind of thing. To get started, I'm gonna also place a mask on my patient and on my own self. And this is just to keep germs down. To do this part here is non-sterile. So I'll wash my hands. I'm going to apply my gloves. When you do this, you want to start from the outside of this dressing and pull it towards the inside, towards the middle where the insertion is at. You can also stabilize this by holding it just a little bit. Some of these are hard to get started, but once you get started, it's pretty easy. I'm going to pull that all the way around, just like this. When you pull this off, I don't have one, but the chlorhexidine impregnated pad should come off with this. Just put this down here in the trash, all on the side for now. For all general purposes, I don't have one of the chlorhexidine impregnated pads, so today we're just going to pretend that I do. Now that I have that all off, I want to set up my sterile field now, and this is not normally how I would do, but this is what we have used today. So in this package, I have a chlorhexidine pad. I'm going to take these gloves off, perform hand hygiene before I set up the sterile field. Obviously, kind of got ahead of myself. I'm going to put my sterile gloves on. To do that, I'm not going to touch but just the outside edges of the paper to open them up. Okay. Now I'll set up my sterile field here, 1 inch all the way around. I don't want to accidentally touch that area. So inside here, I do have a chlorhexidine prep, and what we're going to do with that is we're going to use it to clean this area. You squeeze it, it automatically will come out. I want to put it right on that insertion site just for about 30 seconds. We're going to clean this whole area. As we clean though, we want to go from the inside out. You don't want to go from the outside in, because we're trying to keep the bacteria away from the inside part where this has been inserted. So we're going to clean all the way out, all the way around this way, up through here. Anywhere we feel like that tegaderm and stuff is going to be, I want to get that all good and clean. Clean the catheter part here. Like I said earlier, I noted in the chart how far out this is. These dots represent centimeters. This one here is about 3 dots out. So you want to scrub this good for 30 seconds or more. Sometimes you can't do enough, just to make sure and ensure the patient's safety. Bacteria, since this is going into the superior vena cava, we want to make sure that nothing has a chance to get into the heart. Okay, once I got that done, discard. I'm going to let this air dry. You don't want to wave it. You don't want to do anything like that. You don't want to wave or let a fan or anything, like no air blow on it, just let it dry on its own. Sometimes it may take a minute, sometimes it may take 2 minutes, but whatever it is, let it dry. And once that's dry, then, like I said, I don't have one, but I would take my chlorhexidine impregnated pad, and I'm going to insert it to where the slit goes down. I want that slit to eat this line, so it's going to go around that. Once I've done that, then I'm ready to put on my sterile dressing here. I'll take a Tegaderm. The main thing here is to make sure that, first of all, the site is taken care of first, and then we want to extend down this line. We don't want to leave any of that uncovered, so we're going to put our dressing down to where it goes right across where this conjunction comes into before your other 3 lines meet. So sometimes you may turn it this way, sometimes you may turn it this way. So today I'm going to turn it long ways. I'm going to make sure I get the insertion site, put it all the way over it, kind of push around it. And once you have that, then you can take these outside edges off, paper all the way around it. Just making sure that adheres to it. We want to cover up this bottom part also. And cover that all up, make it nice and neat, making sure that no bacteria can get in there. Okay. Once we have that done, and that's all adhered to it, I'm going to label that with my name, date, and time. We'll put it here on the side somewhere on the dressing. That way the next person knows that I've changed this. Most of the time these are changed about every 7 days, but depending on the patient, depending on their situation, you may have to change these sooner. Sometimes these little hubs here are sutured in. Sometimes they have a stat lock there, so you may want to change that also. But once this is all done, you want to flush these lines. So when you flush these lines, you want to, first you want to clamp these off, take off these hubs, put new hubs on. For each one of these, you'll have to have a flush of 10 milliliters. You kind of give it a little pulsating flush until that's flushed out. Once that's flushed, and we've done so, you want to change the Curios caps, and I have some here. And once those are all flushed, then just put a new Curios cap on each one of these. I've only got one, that's all they had. But I would put all 3 of these on. And that is your central line dressing change.